Alrighty, I am Caroline, and I guess a little bit of background. It will sound a lot like Katie's. I've dealt with anxiety, depression, ADHD, PCOS. Anxiety I've known I had forever. I feel like 2017 I was having like panic attacks, and I was like, something's wrong. Crying, thinking about going to dinner at my parents, and like I have a really good relationship with them, so I should not have been crying. Got on medication, life changed, felt like I was like doing good. COVID hit and my like mental health life fell apart. It was like end of 2020, maybe 2021. I finally got a therapist who was like, we need to meet in person, but like I'm like 99% sure you have ADHD. I was like, what is that? And all of a sudden I found out like COVID hit, and I went into this like major depressive spiral. Like couldn't get off the couch. Eating was always really disordered, but it got a lot worse. And I got a good therapist, and they're like, you have this thing and like it's not your fault. And I realized that when COVID hit, every single structure that I'd had in place my whole life to like make things function went away. Like I wasn't hyper scheduled anymore. Like I was just home. If you give me an unstructured day, expect nothing from me because nothing's happening. And so I feel like I knew I had all of these things that I'd been battling with going into wanting to get pregnant. And I feel like there's all that stigma of like, you can't take all the medications. And I feel like my thing from the beginning was like, I knew I wanted a team. Doula came very late in the process, and
it's okay, we still showed up.
I know. Came late in the process on the day of. But I just like, I feel like the anxiety and like, I know, like you're saying, like having to have control and everything. I was like, I need to plan for the worst. And my therapist was like, okay, I support it, but also like, we're going to just keep you on a leash because that can get really bad really fast. And I was always trying to explain, I was like, no, it's like the good kind of planning. I was like, I'm not really anxious right now, it's fine. And so I picked my therapist years before we started trying to get pregnant. And she had like perinatal, postnatal. She had had a child in the NICU, so she had like a ton of experience. ADHD, anxiety, depression. I was like, oh my God, they built her in a lab for me. And I still feel like that. Like, I feel like I refer to her like by first name to like my friends. I'm like, this is like my girl. Had a wonderful PNP who just like, when you find somebody who just gets it, she prescribes all my meds. She actually, when I was talking to her about like taking Adderall, I was trying to figure out like, what is the cocktail of meds I can take while I'm pregnant that's like okay. And it was a lot of like cost benefit conversations. Did I bring my water? Yeah, I'm not hydrated enough. And it was a lot of those conversations like before even getting pregnant. Like I titrated myself down off of the Wellbutrin that I took for my depression, and I tried to stop taking my Adderall, and it's not good. And we were like, okay, so we're going back on that one. And it really, I had a very supportive OB who was like, it is really like, here's what could happen. Here are the side effects. But it was that kind of like, if you cannot get out of bed, if you cannot care for yourself, you cannot care for this baby. And so that means that taking the medication is worth the potential risks. So I had a lot of that going in. My husband and I got married in October of 2022. Immediately after, I was like, cool, bye birth control. I stopped taking the pill. I guess, hold on, let me jump back a little bit. No, it was this. Okay, sorry. It's been a few years. It's nice to kind of forget the timeline. So we tried to start getting pregnant. I stopped. You know, you hear it's like, a lot of times through my pregnancy and stuff, I would say it's like in Mean Girls, they're like, you will have sex, get pregnant, and die. So I was like, okay, it's easy. Like, we stop the condoms, we stop the pill, baby. Like, that's it. I went 85 days without a period. I went to my OB and I was like, excuse me? It was like, what? And I was somebody who I had been on the pill or an IUD since I was like a child, basically. Like since I was like, I need it for acne, Mom. Like literally forever. Little did I know it was like managing my PCOS for me all these years. So she gives me, I can't remember the drug, but the drug that makes you, like the progesterone to make you have a period. So I get my period and I'm like, all right, this is the time. I went like another like 85, 90 days without a period. And I was like, okay, something's weird. And during those 2 80-day periods, I had gone to my primary care doctor and a lot of like just medical and health anxiety because I've had really disordered eating my entire life. If you ask anybody in my life when I was younger, I was just a really picky eater. It was a choice. And I was like, you think if it was a choice, I would just like eat a vegetable? But so I have all that history. So, and my grandfather had type 2 diabetes and I just like have this fear. I'm like, I don't eat healthy. I don't eat fruits. I don't eat vegetables. Like, I was like, I'm going to get type 2, like it has to. I'm like, because I don't do what you're supposed to. I'm like, so I must, like, I'm not healthy. During COVID and kind of connected to like hormonal changes going to an IUD, I gained 50 pounds in a year. But that was because I wasn't eating healthy. And I was like, no, I've always eaten like this. And I feel like when you gain the weight, it's because, like Katie said, like you're doing something wrong. And I was like, no, but I've always eaten like crap. Like you don't understand, this is how I eat all the time. And I'm like, no, all of a sudden now I'm 50 pounds heavier. And so through this journey of that weight gain, all of a sudden I really was like having to be my own advocate because none of your doctors talk to each other. And so why would they get the whole picture of your health? And so I get my A1C tested. My A1C is in the pre-diabetic range. My BMI, I feel like even before I gained a lot of weight, I've always said I'm like always obese if you look at my BMI. It's never been. So I'm like, okay, fine. But now I'm like in like the bad obese category, like the really bad one. And my A1C is high and I'm not ovulating and all these things. I looked at my doctor and I'm like, something happening. And my OB was like, you have PCOS. She's like, let's do an ultrasound. And they get the ultrasound and she's like, see all those little dots? She was like, those are eggs that aren't they aren't coming out, whatever. She's like, so you have insulin resistant PCOS. So all of a sudden looking back at all these periods of like weight gain and weight loss, it was when I stopped a certain birth control. I started another one. Like nothing else in my life was changing. I wasn't exercising more. I wasn't eating differently. And so I had a lot of that anxiety, like going into pregnancy too, because I'd had a lot of body image issues. Because even though I wasn't big growing up, I was bigger than was allowed. Like bigger than what was like cool and acceptable. And I'd had people like call me fat and tell me that like they didn't know why I was friends with so-and-so because like I just wanted to be like them, but I was too fat to be like them. And I look back and I'm like, now having a daughter and just like, oh my God. And so going through all of this, and I feel like I'm losing my train of thought a little bit. No, my Adderall's wearing off for the day. This is like the dark period when I have to parent because it's not good. But so figuring out all these things, my OB's like, okay, we're gonna try whatever the drug is to like help you. I got put on metformin to help with the A1C, to potentially help with weight loss, to potentially help with getting pregnant. It's this miracle drug that does all these cool things. So I'm taking that, and then I take the drug that makes you ovulate. I took that 2 times and I got pregnant, and I was like, cool, so this is how it's supposed to go. And just as I'm getting like really excited, kind of like coming to terms with the reality of it, I start bleeding. And, you know, I call my OB's office and they're like, I'm explaining what it looks like, and they're like, it's very likely a miscarriage. So I spent 3 really miserable days at home in a lot of pain, just kind of watching myself lose this pregnancy. And then my OB wanted to check my levels to make sure they were going back down because the goal was still to have a baby. and they weren't going down. They were like really low, but they weren't going down. And so with the OB calls and they're like, we're gonna have you come in for an ultrasound. They were like, maybe call your husband at work, maybe pack a bag. They were like, you might not go home for a little bit. And I was like, meh. And they're like, sometimes when the levels stay like that, it means something's stuck around. So we go, we're there. I feel like I've already grieved, like the immediate grief of the loss of this pregnancy. And I find out that it's ectopic. And so I need to go to the ER. So I go to the ER. I ended up being there, I think, for like a day and a half. The only blessing at this one time was my OB actually ended up being my surgeon. So I like to joke that she knows me better than any doctor ever has because she's literally been inside of me. And it was just really scary because I went into the procedure not knowing if I was going to lose both of my tubes. Because they knew they did like the dye thing, and they knew that the one that had the ectopic pregnancy was blocked. And so I knew I was losing that one. And they were like, we're going to check the other one while we're in there. And so my husband and I had to talk and make the decision like before that, like if this is the case. And it didn't end up being, so I get to be like a 1-tube girl. And so I go through that, I go through the grief, the hormones rising, the hormones falling, and as soon as we could, my OB's like, just in case with all of your like PCOS and this and that and the other thing, she's like, I'm gonna make a referral to Boston IVF. She's like, let's just get it started. And it took a while for us to like, we were going through all the meetings, the testing, the genetic stuff. And it took a while for us to feel ready. And then if you've ever done IVF, it takes 40,000 years to get every single level of approval. And like, we are a straight couple. So we had the easy route, and it's insane. And so we go through all of this, and I'm like, all right, I'm ready to start my meds. And my period's not coming. And I'm like, frick. Like, I'm just getting a period. I'm like, why is my period not coming? And so I'm like, could I just like come in and could you guys take my blood, please? I'm like, I just want to know like where my hormones are at, like am I mid-cycle, what's happening? And a nurse calls me like the next day. I go in and get my blood taken. The day after, a nurse calls me and she's like, you're pregnant. And I was like, no. Like my husband and I, like, because of what I just didn't want to have sex. I didn't want to try. I was like, we're doing IVF, that's it. Like, I was like, I don't want to be touched. Like, this is it. But for the male testing, you have to have had sex within like a specific time for it to be like a good sample. So we had very calculated sex because his sperm needed to be good. Whatever that means, fresh. Yes. It could have just been like sitting in reserves. Yeah. And mind you, like we did not plan this with. Am I good? Yeah, maybe. Yeah. Okay. So we had like very timed sex based on when he was getting his testing done. Did not. My medication alarm's going off. Didn't do it like around my period. Nothing. Like after all these like years of like tracking every little thing. I was like, no, we had sex one time. And it was literally like for him to give you guys a sample, like, and my brain was just like, like, what? And so I went through that kind of like tentative excitement of like, I don't want to be excited, but I am excited because it's happening. And because of what I had been through, I fought really hard. Usually they wait to do an ultrasound, I think it's like 7 or 8 weeks with IVF. And I was like, you're going to see me now. They were like, we have to wait until like 6 weeks and a day. Like that's the earliest we can do it for it to be like, to make sense. Like for us to know that you're pregnant, to be able to see it. And I was like, okay, like I want one that day. And I go in and I've been in a lot, like Katie had said, I've been in a lot of ultrasounds at this point. And you kind of start to like get the vibe and like they can't talk to you. And the ultrasound tech was like, okay, awesome. So we're just gonna have you go wait in another room. And I was like, I'm just looking at my husband and I was like, no. in the other room, I had to walk across the waiting area. So you just walk by like all these people, and we go in and sit, and I will never forget, the doctor comes in and he tells me it's ectopic again. But he lets me know that it's really rare. There's only a 10% chance of recurrent ectopics. And I was like, okay, cool, but I'm in that 10%, so like, and then he did what to this day makes my therapist and I'm very upset. He handed me a piece of paper that let me know that my baby had a heartbeat. So I knew we had to go to the ER, and I knew that it just felt like I knew like my baby was going to die. I was like, but it has a heartbeat, like it's alive. And I ended up finding out I spent multiple days in the ER because I had a special ectopic that only happens in 1% of all ectopics, so it was really rare, which again, they just kept telling me, and I was like, okay, but like, it happened to me, so that doesn't help. I was like, I am the 1%. Like, and they couldn't decide if they were going to do interventional radiology, if it was going to be surgery, because my gosh darn little egg decided to go, so I don't have my left tube. But the egg came from the left ovary, made its way to my right tube, went down my right tube, back across my uterus, and wedged itself in the stump of my left tube. 1%. I was like, and of course, I was like, could you just like shove it like back into the, I'm like, if she's like right, I'm like, if it's like right there, could you just, and they were looking at me and I was like, no, is that no? I'm like, I'm not a doctor, I'm like, I figured it was worth a question, like, because they're telling me it's like right there, like it's like the stump, and then I'm like, could we just like encourage it to like grow into the uterus?
I watched Grey's Anatomy, okay? Like, can Addison Shepherd come and do this?
I know, like, Addison Shepherd could make this happen. And I'm like, so anyways, so that happens. And this whole time, like, it's that kind of like, I'm just in there. I know that this baby's heart is beating inside of me, and they're just trying to figure out a way to kill it. Like, what's the best way? At one point, I had to get like the methotrexate or whatever the shot is, because they thought maybe that's what we'll do. So I got that super painful shot. And what made a lot of it worse is we had 2 dogs at home, and my husband had to go home and feed them, so I was just alone in the ER. A lot of the time. Just my luck was a woman who I think had some severe mental health issues across the hallway from me, but was just screaming about being pregnant the whole time. And I was like, I don't know what kind of like cosmic joke this is, but she did not stop. And I was there for like 48 hours. So I had to get another surgery. The only thing that made it better was I got Dilaudid while I waited for the surgery, which basically just knocked me out. I told I was like, I had a really nice nurse, and she came in and she's like, it'll make you feel weird. She's like, but it'll probably help you sleep. And I was like, I want to be unconscious. Like, I can't just like sit here waiting. That one took a lot longer to come back from, both physically and mentally. And once I felt ready, I had to wait for my period to return, all these things. I started my first IVF cycle in May of 2024. I was very lucky. And my first cycle took, which is great because I only had 1 embryo survive. So she is our stubborn, lucky little embryo. But I spent the entire pregnancy, I think, in like a partial state of disassociation, and I think weirdly enough it helped with my anxiety because it wasn't real. I wasn't having a baby. Like, I was pregnant, but I wasn't having a baby. And I think that helped with a lot of the anxiety because I was like, well, like I was like, this isn't real. And Marissa can tell you, and I have video of it, when they put her on my chest, I said, that came out of me. And you can see in my face, like, the moment I disassociate, like when they sat her on my chest. And even then I was like, so I feel like, not to like gloss over my pregnancy, but I feel like it was like pretty standard. I was meeting with all of my practitioners. I finally got to the end and I was like, I feel like something's gonna be bad. I was like, I don't know. I was like, I feel like maybe I should get a doula. And I looked at my husband, I was like, because if things go wrong, I'm like, I need you on me. I can't have you doing like crowd control and dealing with the doctors. I'm like, I need somebody who knows me, who knows what's going on, who knows my complicated history, knows the things to tell people not to say to me. And that was kind of like Katie said, I wanted to stack the deck and hope I didn't need anybody. Like, hope that I got there and it was great and it was super fun and it was fine. And I'm really glad I stacked the deck because I had a very much less than ideal birth experience when I came around to it. And I'd spent a lot of my pregnancy too feeling very guilty because I hated being pregnant. I hated like almost every single minute of it, which was really hard as somebody who always wanted a family. I was like, I'm gonna get married, I'm gonna get a house, we're gonna be like good, and I was like, I'm gonna have a baby, like I'm going to be a mom. And it just felt so unfair. And I also felt really guilty for hating being pregnant because I begged for this. Like I went through all these losses. And it just a lot of complex feelings with my anxiety, with my depression, and things just kind of like this, and like not being able to take my depression medication. So kind of like having to figure that out. And I feel like, if you don't know, Adderall's great, but your hormones mess with how effective it is, which I very much realized through all of these processes. So I'd take it, and sometimes it didn't feel like it was working. And so by the end, I was like, I'm done. Like, get this baby out of me. I'm over it. I would literally look down, and I'm like, if you're cooked, get out. And she came 3 weeks early.
Specifically, the day after we had the conversation on what happens if you make it to 42 weeks pregnant.
I just spoken to Marissa. She came, it was Super Bowl, my dad's birthday, and then she came the next day. And I was kind of talking to people in the beginning, saying like, I thought I was dying. I was very sick. I was throwing up. We had been talking because I had thought I lost my mucus plug like a week ago. I did, and then I got to lose it again. Marissa's like, I mean, it could mean something and it could mean nothing. And I was like, cool. Great. I was like, that's what somebody who likes to have control loves to hear. It could mean tomorrow's the day. It could mean baby in 6 weeks. And I feel like I really struggled at the end because it was like, I kind of equated it to like a mirage, and my anxiety was like, okay, so like we're ready tomorrow, or it could be 6 weeks and I just get to like feel like this forever.
Yes.
And if you have like fun anxiety, it just takes it and like builds it, and it's like, this is gonna be really great. Super fun. And so the day of comes, and I feel like I had a lot. I didn't realize how much medical trauma I'd had until I was headed to the hospital, and I was like, oh no. I was like, the last 2 times I've been in this setting, like I was losing babies. And I also still like was like, I'm not pregnant. Like there's no, I don't know, not a mom, like there's no baby. Even though I'd like feel her kick, and I'm like, okay, you're in there, but like, are you? And I was like, I'll believe it when she comes out, like that I get to be a mom and everything's okay. And my birth experience started with a lovely man. Again, while he has his hand up inside of me and is feeling how dilated I am, going, you didn't know you were in labor? I was like, clearly not. I'm like, does this look like a situation of somebody who knew they were having a baby? Like, excuse you. So that was our lovely start. And I was like, immediately it's just like, cool. And I feel like I just had this like, and I was like, get Marissa here now. And thank God, because Marissa almost had to throw hands.
Don't do that part.
She's like, I don't want to. I don't like having to do this. She's like, but I will. And so as somebody who like really struggles with anxiety, I had multiple times where they tried to give me medication without getting my consent. And Marissa actually had to yell over the doctors and ask them if they had gotten a yes from me. Then I got to sit through while all the doctors were visibly annoyed with me for asking questions about what Pitocin was, what it meant for the rest of my labor. Finally got an epidural, which was fabulous because I couldn't feel anything, but that was also the issue. So I didn't know when to push, which is normal. But when you have a nurse who doesn't know how to feel for contractions, like she would literally be palpating my abdomen, and they told us 1 to 2 minutes. So Marissa was like, cool. Like Marissa's got like everything. She's on top of it. And the nurse is like, so you're like 5 to 6 minutes apart. And Marissa was like, we were just 1 to 2 minutes. And an older nurse comes in and goes, she's literally contracting right now. And I'm just looking at Marissa like, how long has my body been laboring where I can't feel it, but it's exhausting itself. Like I'm using up energy and reserves. And so we go through that, used up how much of my good epidural time because my epidural came out completely, which the lovely male doctor, he didn't even tell me no. He just like ignored it. Like I was back to the point I don't throw up. I was like curled over in bed, throwing up from the pain that I was in, screaming, crying. Like my husband, I'm like about to faint. I'm like so hot. I was fully nude. I got fully nude very early on at the hospital. I have a lot of sensory issues. It was like to the point I was like, I can't have anything on me. Like I'm going to overheat. And like, so I had done like everything. We had cold, we had like this, my husband's wiping me off, and like he did not leave my side. So I'm very glad we had Marissa because he was not fighting the doctors. And this guy just keeps telling me, this is what labor is. And I'm like, but I feel like I'm dying. Like I'm like, this can't be it. Like I'm supposed to have the thing that's like numbing, and Marissa's going through, she's like very early on. At this point we were about to yell at people, but I was like, no, I feel like I can feel my legs, like I can feel my toes. I'm like, that's not supposed to, I'm like I can feel things. And Marissa finally she was like, you're getting the anesthesiologist now. And they're checking her out. And the anesthesiologist comes in and is like, why did no one call me sooner? The epidural is out. And I'm also somebody, I don't like needles. I have a lot of trauma with needles, like when I was little. So the epidural was something that I was just really afraid of. It took a lot out of me, and I had to go through it twice. And I feel like when you're in that much pain, having to bend over in a position that's not comfortable, having to stay still, and having to like, after this doctor had told me like, this is just what labor is, this is just what you go through. Now that happens, I get my epidural, we finally get a nurse who can feel what contractions feel like and knows when to tell me when to push. I did get told that I wasn't pushing correctly a couple times. And I was like, again, I've never done this before. Like,
in the most dismissive gaslighting way possible.
Oh yeah, it was fun. It was super fun. I was like, great, what do you want me to do? I was like, I'm here, legs spread, like to the sky. I'm like, what? And I feel like it just makes everything so much harder because like you're just out there. Like everything is out there, and they're like, you're doing it wrong. And you're like, not like, hey, like coach me into. Marissa is actually helping me like, okay, we're gonna like take a big deep breath, like here's what we're gonna do. Marissa kept having to like pull me back because I feel like they would say something like, what? And Marissa's like, okay, me. Like I was like, it's just Marissa and I in the room. So I wasn't pushing correctly, I wasn't doing things well enough. And then all of a sudden the baby was coming and everybody's freaking out and panicking. And my anxiety is like skyrocketing, and they're like, don't breathe, don't smile, don't laugh. And I was like, what is happening? Like, what? Turns out the baby was about to come out, but the OB was nowhere to be found. So I'm just like there, like, huh? And I'm like, she's just gonna, and they're like, stop pushing. And I'm like, I'm not doing anything. Like, my daughter's just coming out. I'm like, I don't know what anyone wants from me. She comes out, I get her put on. They were very adamant about cutting my cord quickly, and I kept having to say no until it was white. After we go through all that, my placenta didn't come for 45 minutes. It's a really long time. And the team that was there did a lot of talking around me, and no one was talking to me. And the moment that I remember the most was at one point they take her to go do her test, and they don't bring her back. And she hadn't done like the big gasping cry, like she was awake and she was alert. And one of the doctors just really nonchalantly goes, yeah, we see this sometimes in mothers who take medication for anxiety and depression. And I was like, so I hurt my baby, because she wasn't breathing like she was supposed to, and she wasn't doing things. And they just literally like so dismissively basically said it was because I was on antidepressants that like my baby came out and didn't take this big first breath. And then I feel like I'll kind of go quickly through a little bit, but I had an incredibly difficult time breastfeeding because my daughter was like this big. She was 6 pounds 5 ounces, and her mouth was like, and my nipples were Marissa took some pictures that still to this day I'm like, we called them, Marissa goes, I just have to, she goes, it's like porn star boobs. Like it literally, because it's like my daughter's teeny head and then it's just like boob mountain. And didn't have like good help in the hospital, all this stuff. One thing that made a lot of this really hard too is, I kind of forgot to mention, but was a big part of a lot of like the anxiety was we used to have 2 dogs. We have 1 dog now. And we rescued a dog right before our wedding. He was so sweet. And we didn't know for a little while that he had issues with biting. He bit me probably 3 times during the pregnancy that required me to go get like medical attention. And it was like resource guarding, and he was the sweetest little dog. But he had a really bad couple of homes before us. We're pretty sure he was abused like in his first home. And he was the best dog. Like through all of my losses, he was like my little shadow, and he would just stay in bed with me. But we knew really early on that we couldn't have him in the house with the baby because I was like, I couldn't live with myself if he bit our daughter. And I mean, he bit me as close to like a week before she was born. And I was just trying to put his coat on. And we did so much work. I mean, we went to a behaviorist, we talked to his rescue, and we knew that we were going to have to get rid of him. And I think it was like night 1 in the hospital, I finally get a call back from the rescue because we'd been waiting to find out what was happening. And the rescue told us that they couldn't take him back because they wouldn't be able to place him. And so that meant that our only option was to put him down. And my husband was asleep, and the baby was asleep in the bassinet, and I was just sobbing. And a nurse came in and sat with me. But we went home from the hospital like knowing that we were going to have to put our dog down. My husband had to do it himself because I was 2 days postpartum. We put him down on Valentine's Day, which also really sucked. And so that was just, it was incredibly hard because he was perfectly healthy. And we knew we couldn't have him around the baby, but to just have to like put down, to choose one life over another was just like really, really difficult. And I feel like that it weighed a lot on me during pregnancy and in that that immediate postpartum. And after we put him down, I just kind of bottomed out. And I was really glad that I had the team that I did, because I couldn't, if I was if I was awake, I was crying. I couldn't cope. Like, I was just sobbing on the phone to Marissa. Marissa was like, do you want, she's like, I have people for you, daytime, nighttime, they will be there. And I'm pretty sure, the next day, I had one of my 2 amazing postpartum doulas in my house. And I'm somebody, I don't like to ask for help. If I need help, I'm failing. I'm supposed to be able to do it by myself. That's the thing in social media you always see. It's I don't have to do everything, but it just needs to be perfect. And I can't tell you why, but it does. And so I feel like having to accept that help was so hard, but I feel like I'd kind of with my depression and anxiety, I feel like there's this big gray period where I don't really know what's happening. And I feel like then it'll get bad enough and I need help. And it was I couldn't talk to anybody without crying. I couldn't walk down the stairs without thinking about my daughter dying because I was going to drop her and I was just gonna, and I could see her like in my head, like falling down the stairs. And I spent a lot of time just sitting on the couch going, I can't believe I did this to myself. This is my life forever. Like I can't undo this. And then feeling horrible because I lost babies. And how could I not appreciate what I had? And then I see this little human being and I'm like, how can I think that when she's just like right there in front of me? And I think a lot of it was sleep deprivation. Our overnight doula was so sweet. She was like, okay, go to bed. And I was like, okay, but so she just needs this and you have to do this with her bottle and you have to, and she was like, go to sleep. Like, very, very nicely, like not dismissively, but she was like, up to bed you go. Like, that's why I'm here. It's gonna be okay. Like, we'd met her and talked to her before. But it really, if I didn't have a therapist who I knew and somebody who managed my medications, I had met a lactation consultant beforehand. If she did not come over, I don't know if I still would be breastfeeding. Because in the hospital, it was very much like my fault. Like, it was just supposed to be working. They were like, oh, the football hold's not working. Like, oh, your boobs are too big to, like, do the sideline. You're, like, gonna, like, squish her. And I was like, I don't know. And you're just, like, exhausted and everything. And I get this lactation consultant. She comes in. She didn't have a lip tie, but she's like, there is no fat on her body because she was so early. She's like, she missed her, like, fat gaining weeks. And she's like, babies really need, like, pockets in their cheeks to be able to breastfeed. I'm like, so it's not my fault and it's not her fault. Like, she's like, this will fix itself. It just needs time. And she was the first person to be like, you can give her a bottle. And it's not, because I feel like I'd heard if you give a bottle, like, basically it was like, I failed at breastfeeding and she can only have a bottle forever. And like, I just always pictured breastfeeding my baby. And so to feel like I was failing at it before I even knew what I was doing was really hard. And so having that entire team, like, I think it would have been a lot worse. I mean, I had medications to help me sleep. I had my anxiety medication and my ADHD medication, and still that pressure always in the background of like, I'm having to choose all these things. Am I choosing them at the expense of my child? But I can't function without them. So like I'm dealing with this a lot in therapy right now, because it doesn't go away. But knowing that like choosing myself is choosing her because I can't take care of her if I don't take care of myself. And I got through it and the thoughts started to go away. The phantom crying that was always happening started to disappear and it felt like I'd like finally come up for air. And I feel like I've had ebbs and flows. A couple months ago, I don't know what changed, but all of a sudden I just had that feeling like the depression just started sinking back in. And I was on my depression medication. So it's not supposed to happen when you take your meds, but it does. And I think I don't know what it had to do with, but all of a sudden there was one day I was like sitting with my daughter, and I feel like she's like more conscious now. Like the beginning I'd be crying, I'm like, she doesn't know what's happening, like it sucks, but like she's just kind of like, she can't even see far enough to see me crying. But she's like very conscious and aware now, and so I'm just sitting at the kitchen table and I'm just like sobbing and I can't pull it back. And she's looking at me like, she just looked like confused and concerned, and I'm trying like through tears to say like, I'm okay. I'm like, I don't know why I'm sad. I'm just like, mommy's really sad right now. And it's like really hard to be depressed with a kid because you can't just be depressed. I would go and like lay down and go away from the world and like say I want to take a break, and you can't do that, especially when your baby breastfeeds. And is a big boob girl. Like my daughter is a boob girl. Like inconvenience boob, hungry boob, mom boob. Like I get changed boob. She's like, okay, we eat now. And so just to be like constantly needed. And also somebody like, even with friends, I'm like, if you constantly like, we're just not compatible, like I need a friend I cannot see for 6 months and then we get together. It's like, I see, we're fine. So I feel like I went through that again recently of just like, it felt very different than the first time. And it was just this kind of like, I thought I was good. Like I'd been making all these changes for my health and trying to take care of myself. And it was in the midst of deciding to start this new medication, which again kind of felt like there's not enough research on it with women who are breastfeeding. And having to make that decision to take care of myself, possibly at the expense of something, going to my daughter. So yeah, it's just really hard, and knowing that like this is just kind of what it is for me. Like depression comes and goes. There's no reason for it, and knowing that like my anxiety is kind of always there, and like my meds keep me from having panic attacks on the daily, which is great, but like it doesn't get rid of all the other things. And I feel like if I can like sum up everything in one way, like if I did not have a team pre, immediately post, and now, I think I would be in a lot worse place. And I think on top of having a team, it was having a team that is supportive, and supportive of somebody who's not like the perfect like birthing specimen. Like I had a lot of things like going into it that were like complicating, and yeah, so I feel like there's probably a million things I forgot to mention because I didn't look at my notes like one time. But I think it's just been like a whole journey of like, I feel like I knew how to be somebody who had like mental health problems because I've been dealing with them for so long before my daughter. But then all of a sudden it's like you kind of get kicked in the teeth and you're like, oh, okay. So you don't just get to have them now, like you have to have them and also keep a human being alive who now wants to be entertained every single minute of the day. Like having to listen to the Tony box while you cry is just a weird disassociative experience, like almost yelling in the background, and I'm just like, I want to be unconscious. So yeah, I feel like it's been a whole thing. But yeah, I guess that's kind of, now I'm here, my depression's getting better though. I upped my meds. So yeah, that's me.